Hi, everyone. We're going to give folks a couple of minutes to finish logging in, and then we will kick things off in a minute or so. All right, well, we can go ahead and get started. My name is Jessica Day. I'm on our growth team here at CareMessage. And today's agenda is just going to be sharing a little bit more about CareMessage and our work, also our platform that we're offering to safety net organizations called CM Light that we'll be doing an overview of. And we have Lainey McMillan from Sunrise Community Health that will be sharing a little bit about her work. We'll do a brief demo of CM Light just so you can get a look into it, and then we'll have a Q&A at the very end. So feel free, if any questions come up during the presentation, you can use either the chat or the Q&A button at the bottom of the window. And so please include the name of your health center and your question, of course. And after the webinar, we'll be sharing out the presentation slides and the recording via email afterwards. So I will go ahead and hand things off to Christine.
Good morning. Hi, everyone. My name is Christine Chang, and I am the Strategic Partnerships Manager here at CareMessage. We're very excited to share our free COVID-19 solution with you all, and so we'll dive right in. CareMessage, we are a 501c3 nonprofit organization building healthcare technology, specifically patient engagement technology. We were founded in 2012 as the first and only patient engagement platform dedicated to and for underserved patient populations, and thus the healthcare organizations that serve them. Through the work and the focus that we have as a nonprofit, we work with close to 300 safety net organizations in over 40 states and reach over 6 million patients. Since March of 2020, at the beginning of the COVID-19 pandemic, our organization has helped facilitate the sending of over 16 million COVID-19 messages, and specifically with our CM Light solution that we'll be talking about today, have been able to offer this to over 100 organizations. In the state of Colorado, we are extremely proud to work with some safety net providers already. This is both through the CM Light product that we'll talk about today, as well as our full platform. So of course, we have Sunrise Community Health on the line to share about their experiences with text messaging. And we're also proud to work with organizations like Peak Vista, Clinica Campesina, and Uncompahgre. In response to COVID-19, CareMessage, of course, released our free COVID-19 solution that we'll be talking about today. And in the weeks that followed, created an internal and external initiative called Project Equity, which is a concerted focus that we have as an organization to continue the work that we're doing to reach safety net organizations, but specifically those serving large populations of patient communities of color. This includes communities including the Black and/or African American patient community, Latinx, Native American, American Indian, Alaska Native, as well as rural and migrant patient populations and the health centers that support them. In summary, CM Light is a free solution for safety net organizations and focuses on providing safety net organizations the ability to regularly and efficiently reach their entire patient population or groups of patients during this time. The functionality focuses on two types of messaging. The first being group outreach, so sending a single message to hundreds or thousands of patients. This can be to notify patients of testing availability, food bank resources that are in your community, as well as clinic closures or clinic openings as that changes on a week-by-week basis. And then the other ability or functionality for one-to-one patient messaging. So today, the way we see our users using direct messenger in CM Lite is for care coordination, care management, any type of one-to-one communication that anyone within the health center might need to have directly with a patient. CM Lite is intentionally designed as an unintegrated solution, meaning we don't integrate this solution with the EHR or a population health management solution, because we wanted to offer health centers the ability to get started with CM Lite within a matter of days or even hours of gaining access to the platform. During the demo today, I'll show you what it looks like to actually upload a patient list into our file center so that you can begin messaging patients. Because some folks do ask, our full platform does offer integrations, but CM Lite, again, is a focus on being able to provide a solution to health centers and organizations who otherwise didn't have the means to get out large-scale communication in an automated and efficient fashion. In addition to the product itself, CareMessage has an equal focus on developing content designed specifically to reach and engage underserved populations, and specifically those in rural communities. What this looks like for us in our COVID-19 response is creating on a biweekly and tri-weekly basis content based off of the use cases and the feedback and requests that we receive from our partners today. As such, we've made our message library for COVID-19 topics and use cases free and public, meaning you don't need to use CM Lite or CareMessage to have access to this library. And then for our CM Lite users, they of course always have the ability to personalize or craft their original messages. Our library acts as a resource for our partners such that they have content at their fingertips that's written at a 6th grade reading level or below, offered in culturally relevant Spanish translations, and addresses use cases that we know are especially top of mind for safety net providers in being able to, for example, support telehealth. We know that in rural communities, telehealth is already either already adopted or incredibly important during this time, given the time it may take patients to come into the health center. So we'll talk a little bit about that example. And before we do, I do want to be very clear that this is a free solution for safety net providers. We are offering this and are proud to offer this because of generous philanthropic support received from organizations like Johnson & Johnson to offer this platform for a minimum of 60 days to safety net providers. And there's no obligation to CareMessage or long-term commitment to purchase our platform after the use of CM Lite. Again, just wanted to share a few examples of how we see our partners using CM Lite today. The messages that you actually see here in the screenshots, these are messages that our partners have sent. They're anonymized in this case, but we know that it's especially top of mind for our health center partners to think about how do we let our patients know telehealth is available? How do we let our patients know that it's safe to come in, and that if they are out of compliance with a visit or a screening that they should be receiving on a regular basis, we want to make sure that that patient feels safe about coming in. We also know, of course, resources related to non-clinical concerns is especially important as well. So you see the example of drive-through for fruit and veggie pickup, connection to resources including housing, legal assistance. We know Medicaid eligibility is incredibly important, especially as so many are seeing their employment status impacted during this time. The telehealth example here is one that we've also seen our partners send out. Again, as many health centers, especially those in rural communities, have adopted telehealth as well. They're trying to understand what technology do our patients have access to in their home, what technology are they comfortable using, and we know full and well that it's not enough sometimes to have access to Wi-Fi if you have it, but even having a specific broadband speed that health centers ultimately need to discern so that they can learn how to best serve their patients. Because outreach and our CM-like solution is bidirectional, you'll see here that based off of how a patient replies in this multiple choice survey, CareMessage will automatically send the appropriate resource or the appropriate response. With that, I'd love to introduce or reintroduce Lainey McMillan from Sunrise Community Health to share about her organization's use of CareMessage.
Sorry about that. Good morning. We were limited, sorry, I'm not a public speaker, I apologize. We were limited reaching out to our patients with our phone calls and our letters during this time. And so being able to text them, we have been able to reach a broader scope of our patients where we weren't able to reach them before. We were only having one-way texting with our previous platform, and I'm sorry. So we were very excited to be able to use CareMessage, where we do have the ability to have two-way messaging with our patients, where we're able to better connect with them and respond in a more timely manner, where we don't have to try to play phone tag. Most people have their phones with them at all times and are much easier to text with than to make phone calls. We've been able to let them know of the things that we were doing during this COVID period, such as our grab-and-go pharmacy, our lab-and-go, which helped decrease the traffic in our clinics to keep both our patients and our providers safer from the COVID crisis. And we've been able to allow them to get the messages prior to coming in, whether it was to wear masks, we were going to be closed, just to keep them in their homes more if we could and protected by wearing the masks. And what we're looking forward to doing in the future is being able to implement the bidirectional appointments, where we're able to communicate better with them. If they need to reschedule, they can text us, we can get them rescheduled, and they just don't no-show. And just be able to get our staff able to use their time on different focuses, because we can text them on a larger scale, whether it's for our diabetes care, you know, hey, we need to get you in here, we haven't seen you in a while. We can send out a larger text to those people and hopefully get them in and get them the care that they need, as well as our colorectal patients, following up with our fit kits. We just wouldn't have to have so many phone calls going out. Maybe we'd be able to reach them in a more timely, easier manner by using this. And we're super excited to be able to use this and be able to focus it on what we need to. The text messages that they have pre-programmed are great, but I love that we can customize it to fit our needs during this time. And that's it.
Thank you, Lainey. We're so pleased and proud of the work that we've been able to accomplish with Sunrise. And Thank you for your partnership and for sharing a little bit about how your organization has adapted and thought about patient engagement, especially during this time.
Yes, thank you.
Of course. With that, I'd love to go into a brief demonstration of CM Lite to share some of the functionality that we described. So I'll go ahead and I'll navigate over to the CareMessage app and I'll begin to log in. We're now sitting on the home page of CareMessage and want to start, of course, by sharing that none of the information or patient data that you see here is real. It's all fake in a demo environment. And I'll take us through the workflow that health centers go through when they're getting started with CM Lite specifically. And that starts with uploading your patient list or your patient population into CareMessage. As a reminder, again, CM Lite specifically is designed as an unintegrated solution because we want to give health centers the ability to get started with our platform, again, within a matter of minutes, hours or days of having access to the platform. And so they'll start by uploading patient lists into the platform. Through the file center process, what's powerful about this is not only the ability to get your patient information into the system very quickly, but the ability to create patient groups or cohorts for messaging. In the file upload process, you'll be asked if you want to actually put the patients in that list into what we call a group. And from there, you'll have automatic cohorts and groups that you can select when you start sending out outreach messages. Even if you don't want to create groups through the file center process, you can, of course, always access your entire patient population and those who you're messaging in the Patients tab of CareMessage, so you can see all the patients that you have. And then from there, once you do have your patient list uploaded into our platform, you can begin sending messages. I've navigated over to Outreach, which is that one-to-many messaging functionality. And so in my demo environment, you'll see that I have a lot of examples of messages or campaigns, as we call it, that we've historically sent. We can take a look at messages that are active and ongoing. And we also have the ability to see messages that we have scheduled to send out in the future. This allows teams and health centers to coordinate the messaging to make sure that patients aren't receiving too many messages at any given point, as well as providing that right level of visibility between care management, quality, patient access, and even your community health worker teams and other folks and departments within your organization. When you're ready to send a message, you can click on Create Outreach, where you'll be brought over to the campaign creation page where we can select the patients we want to reach. And again, this is where the groups functionality is so powerful to be able to select the patients that you've already put into a cohort, or you do have the ability to search and filter directly from this picker. And then from there, once you have selected who you want to reach, you can then access CareMessage's COVID-19 messaging library to upload and create templates in the platform itself. And I'll already have a few preloaded into the platform. We offer 8 preloaded already based off of, again, just the use cases that we see are especially top of mind for our users. And so as a great example here, we've gone ahead and uploaded our social distancing template. Again, CareMessage offers all of the content in culturally relevant Spanish translations. And so you see that example here, where based off of a patient's language preferences, CareMessage can, of course, automatically determine who should be receiving what message in what language. Upon selecting a template, I will schedule a date and time for when I want this message to go out, and then I'll click in the bottom right-hand corner, Create, to set up this message. Let's look at an example of a completed or active campaign that we've sent historically. And so again, this provides visibility to different folks within the organization to understand who did we reach in the past, what was the overall response rate for this bidirectional message, and were there any patients who opted out? I can drill down into the patient tab to see specific communication that we've had with patients. And so, for example, you can see here the different responses as they've come in. And though this is a very small sample size, you can imagine that as we begin to message hundreds and thousands of patients, you're going to want the ability to filter by responses. CareMessage will automatically flag patients who respond with a different response. So if you've set this up as a yes/no question, and perhaps the patient writes back, I don't know who this is, or something else, CareMessage proactively flags that response for easy review by the health center. And then from there, you can determine what follow-up would be appropriate. Oftentimes, we see our health centers then going over to Direct Messenger, which is the one-to-one patient communication functionality, again, included in CM Lite for communication directly with patients. And so you see in this case, we have an example of a patient texting back and forth with the health center to confirm their connection to a housing agency and a local resource that they might have highlighted as needing. And so again, one-to-one messaging with our Direct Messenger. With that, with 8 minutes to go, I will conclude the demonstration here and open up the webinar to any questions. Please feel free to use the chat or the Q&A for questions that you might want to ask myself or Lainey. And as folks are submitting their questions, I do want to provide and hover on this slide, as this includes all of the resources for getting started with CM Lite directly from our website. You can sign up to get in touch with our team, as well as access the free resources, including our message library, as well as telehealth videos that we've recorded for any safety net provider to use. The telehealth videos specifically are created for our health center partners to send out to their patient population as they do transition to using tools like Zoom or Doxy.me to support their patients in understanding how to use these technologies. We have one question for clarification. So is this available for 60 days free? And what does the process look like for discontinuing the use of CM Lite after 60 days? It's a great question. And this is available for a minimum of 60 days. This is made possible because of our philanthropic partners that we have. And as far as discontinuing the use of CM Lite, we will automatically, throughout the course of your 60 days, communicate and make sure that the health center users are aware of approaching their 60-day mark, and we'll make sure that they're prepared to offboard off of the platform, whether it's getting the data that they need or potentially identifying if they want to use the platform for longer than 60 days. But want to be really clear that this is a 60-day offer and that there's no 12-month commitment. There's no pricing that kicks in that would take a health center by surprise. There's no long-term or obligation or commitment. Another question, reconfirming, absolutely yes. We will offer this demo recording and presentation deck to everyone who's attended today, and for wider distribution to folks on your team who might not have been able to make it. We'll give folks about, oh, I see a question coming in. Oh, thank you, Gladys, for attending. We'll give folks another 30 seconds or so to submit a question, and otherwise we'll conclude the webinar. Thank you, everyone, for your participation today. Thank you, Lainey, for sharing your work, all that you're doing at Sunrise, and of course to Matt Enquist and the team at Colorado Rural Health Center for having us. We are so proud to be working with you all during this time and look forward to future collaborations. All right, and with that, we will go ahead and conclude the webinar at this point. Thank you again, everyone, and have a great rest of your day.